So today we are going to discuss how to interpret imaging. So the part one of this video is that when to request for a chest x-ray. So we know that chest x-rays are usually performed in patients with respiratory symptoms, but it can also be performed in patients who have abdominal issues or have weight loss issues, just to see like what is the problem with the patient. So, because chest x-rays can have a lot of radiation, we need to know that what is this radiation dose and how is it measured and what each imaging um, poses the risk of these radiation to the patient. So, we should know that the radiation dose is actually measured in millisieverts, okay? And the average exposure of environmental radiation to a person is about 2.4 MSV per year. For a CT scan, we have about 7 MSV, and for a CT pulmonary angiogram, we have about 15.0 MSV. For a plain chest x-ray, we have about 0.02 MSV, and for a low-dose CT that is used for lung cancer screening, we have about 0.8 to 1 MSV per CT. We should also now know that there is a term known as ALARA. ALARA means as low as reasonably achievable. So, this is a prompt to consider alternative imaging modalities which do not require radiation, such as ultrasound, to answer the question. Also, in pregnancy, we should always know that the mother is actually in danger instead of the fetus when ordering a chest x-ray. And in pregnancy, the breast tissue is actually sensitive, so it can cause a risk of breast cancer, and we should assume that it would be higher. So when requesting a chest x-ray, we should know certain things. One is that patient details. We should always double check them, see what is the name of the patient, what is the age, what is the gender of the patient. We should always know that if the patient is pregnant or at a risk of any infection. Because of legal implications, we should always log out after making a request and do not allow anyone else to work on your EMR or while making request. We should always include full clinical details because most radiologists see a lot of patients and they don't remember that patient. Most radiologists don't even get to see that patient. So make sure that you tell in full clinical details, especially that something that you want to know. And this means that if you're requesting a chest x-ray, there is definitely something that you want to rule out or rule in, or there are any symptoms that you think point out to a disease but you're not sure about it. So you always must tell that what do you want to know about in this imaging. So whenever a chest x-ray or any imaging is requested, it is available to review for the clinician as well as for the radiologist in PACS. PACS is Picture Archiving and Communication System. So these electronic requests are actually queued in the work list and for the radiologist and the radiographer, and then the patient is called in order of urgency, and then all these imagings are then available in PACS, and then the radiologist is you know uh, can report these imaging. But if you need to discuss something really specific, you can go and meet the radiologist in person and make that request. Thank you.